This conversation isn't about who does what better. It's about access, expectations, and what actually benefits patients. Especially in a system with long wait times and limited providers. Andrew Springer is joining us today after traveling by train from Toronto and returning the same day just to take part in this conversation. That alone speaks volumes about his commitment to his work. Andrew is a practicing chiropodist with over 4 decades of real-world experience, spanning clinical care, education, and professional leadership. His background includes extensive work in diabetes-related foot conditions, wound care, and complex patient management areas that are critically important to foot care nurses. He has held senior leadership roles within healthcare and professional organizations, taught across multiple post-diploma programs, and brings a deep understanding of how standards, education, and clinical practice intersect in the real world. We are incredibly grateful for Andrew's time, expertise, and dedication, and we're honored to have him here today. How are you?
Hey, great. Thank you so much for having me.
Thank you for coming. You came a long way.
It was worth it.
Thank you. And tell us a little bit about yourself.
I've been a chiropodist since 1983. Practicing first in hospitals, North York General Hospital, West Park Hospital, Providence Center, where I also managed their clinics in a dementia unit. Started private practice, I'd say about 93, 92 maybe, and worked with a group of family physicians. And then when I left Providence Center in 2002, I went out into private practice, 2003 in Oshawa. I practiced in Oshawa, Toronto, Timmins. I did some consulting work in Bangkok as well.
Wow.
So
amazing. And you're on different boards, I feel?
I have been on several boards over the years. It was the group that founded the Ontario Society of Chiropodists and have served as president 2 different times during the time when we were negotiating the Regulated Health Professions Act.
Wow.
And then again in 2008 to 2010. I chaired the college board, the College of Chiropodists of Ontario. I was there for 6 years, I think 9 years on the board in total. And I'm now chair of the Board of Wounds Canada.
Nice.
And I've been there since 2013.
Amazing. Do you love it so much?
It's a really important thing, I think, to educate not just professionals, but to advocate to government for the proper supports.
Oh, yeah.
To see that people are educated, that the public are educated, but that also care can get to them.
Yeah, it's crazy. And then, so from your perspective, how has foot care changed over the years, especially with chronic disease like diabetes?
You're going to be disappointed, I think, in my answer in that not a lot.
Really?
Because it's been a struggle for foot care to be accepted as something that's important.
Yeah.
And that struggle does continue.
Yeah.
What is different now is that there are more people out there providing foot care, chiropodists and foot care nurses alike. I mean, I was in a class of, graduating class of 18, and we were the first in the country.
Wow.
So there weren't many, so there are more now.
Yeah.
But it's still a challenge. The foot is, out of sight, out of mind, and forgotten. And there's something cultural about that. People don't talk about it.
It's wild. Wild. Or what are you seeing as the biggest gaps in access for foot care right now?
Healthcare has always practiced in silos. And so everybody does their thing, and there's not a lot of connection. And that remains a problem, though some of those barriers are being broken down. But patients fall between the cracks because of those silos. So people feel, I've done my job, and they let the person go when, in fact, their care isn't complete.
Right.
And so there's the problem where people fall through the cracks. I had a 27-year-old type 1 diabetic who had a wound on his foot, was sent to me by infectious diseases at a certain hospital. And he was almost healed, and he got a new job, and he had to go out west for training for 4 weeks and came back infected and all broken down. Right. I put him on antibiotics, came back, and he was much better. He had cellulitis halfway up his foot. When he came back, it was one toe. But I said, you know what, maybe you should go back to infectious diseases just in case you need something else. They said he needed a new referral from his family doctor, which he didn't have. He went to them through emergency, number one. Yeah. And when I called the ID guy, he said, it would be weeks before we can see him anyway, so he might as well go to emerge.
Wow.
So
There's such a gap.
And he chose not to, but he healed, thank goodness.
That's crazy, especially with our aging population as well, right?
Well, that's it. And that's where communication is very important, where education for them is very important, where eyes on the foot are very important. And so the more people involved, the better.
And then there simply aren't enough. So is it chiropodist or chiropodist? Like, do you have a preference? Tomato, tomato? Like, is there...
Would you say chiropractor? Same spelling.
No.
So chiropodist. You'd say chiropractor only, right?
Stop the madness.
There
I
you
never... Chiropractor.
You'd say chiropractor, not
Chiropodist.
chiropractor, so chiropodist, not chiropodist.
No one's ever said that.
There you are.
Learned something new today. So there simply aren't enough to meet the demand. How does that reality force you to do something more team-based? Does it force you to do something more team-based, or like what are your thoughts on it?
It depends what the center of your universe is. If
Right.
it's the patient, you should be doing team-based stuff to start off with anyway. So where teams don't exist, it's really your onus to create them, to develop the relationships. And I'm in solo practice, so I've had to knock on doors and talk to endocrinologists and talk to infectious disease specialists and set up those networks myself for the benefit of the patient.
Right.
Studies are showing that team-based care benefits the patient more than solo practice. So if we're thinking about the patient, we do it anyway.
Right. Because you need that referral base, right? Especially with us foot care nurses to see where there are chiropodists around where you can, because we can't do something that's outside of our scope. And so then where do they go? And holistically, you would want to refer or have that care plan where they can go and be seeing something over and above your scope, especially if there's a wound.
Sure.
Then, right?
That makes sense.
But there's not a lot.
And logic does not always apply.
No, and there's a history of them not liking us, I feel.
So well, here's the thing. And that's not just in foot care, that's in health care. People really are territorial.
Right.
And so here were chiropodists coming onto the scene, trying hard to be understood and get their share of the pie. And then all of a sudden there were foot care nurses. And so a lot of people felt threatened. What they didn't realize, again, was here as a potential ally.
Right.
84, maybe 85, I taught a nursing foot care course or courses. In those days, it was for RNs and for RNAs.
Right.
And we had 15 hours in class, 15 hours in clinical. And that brought referrals. Over the years, I've done clinical audits for Durham Community Care and Oshawa Senior Citizen Centers on nursing foot care clinics.
Right.
I took a lot of heat from my colleagues. Why are you helping the nurses?
Really?
Whereas I saw it as helping the patients. And in
Right.
fact, it brought me more referrals.
Right?
And I have, for people who
Ding,
are
ding, ding.
in home,
Yeah.
I have nurses that I can say, here's somebody you can go see.
Right.
So it works, again, with the patient at the center of it. It works for the patient, but it works for us as well.
Right. Then it kind of decreases those wait times as well if you've got such a waiting list because there's so few
Sure.
chiropodists around, right?
Yeah.
What role do you believe foot care nurses can play in improving access and continuity for patients?
In terms of numbers alone, that can certainly help. Within my own environment, to bring a foot care nurse in the office means that I can focus on the most complex of cases and people still get care. Right. And if there's a need for escalation because of a condition, a wound, or whatever the case may be, that communication exists. So they're still looked after.
And you must be so busy. Like, are you incredibly busy over where you are?
It is busy. It is busy. And the thing is that you want to ensure that you have the time for the people who need you the most.
Right.
And by having a foot care nurse there, we can ensure that and yet make sure that everybody gets what they need.
Right. Then it would just be more valuable to like patient outcomes.
Absolutely.
Right. So just earlier intervention, monitoring, education.
The monitoring is really important. The education is really important.
Yeah.
The personal touch is really
And it
important.
escalates the care as well.
Yeah, for
right?
sure.
Okay. Is there still tension in some areas, a feeling that foot care nurses are taking away work and overstepping? Or do you think that perception, why do you think that perception exists? But I think we kind of covered that a little bit. Or is it just a rumor?
And to be honest with you, I don't listen to that stuff anymore.
Yeah.
Not interested.
Here, where it's really good, we have 2 chiropodists that we work with, and they're incredible. And they like the surgical part, and we help them with the foot care, and it's able to expedite everything.
Beautiful.
And it's just literally, a care plan for the patient, with them in the middle, with them being looked after. And it works out incredible. So I don't know why anybody wouldn't want to do that sort of multidiscipline care pathway.
Because they haven't been able to take themselves out of the center and push the patient into the center.
Yeah. And then what do you think people misunderstand most about the role of a foot care nurse? Did you have any sort of expectation, I guess, because you taught, so you sort of knew what our role is or what our role could be and how valuable we could be. But
so I perhaps come at it from a different angle. So there are people who minimize the role of a foot care nurse, whereas my frustration has been foot care nurses not living up to all they could do.
Right.
So in some of the audits that I've been in, I've heard you in earlier talks talk about some of the standards and some of the ways that they were practicing. And I would encounter some of those things and and then meet resistance. Well, who are you to tell me? Well, this isn't chiropody. This is good practice. This is
right. These are standards.
Infection prevention and control, and they were doing things because it's the foot. So it doesn't matter.
So you've kind of touched on this. Would collaboration of foot care nurses dilute care or strengthen it?
Absolutely strengthen it.
Strengthen it, right?
The important thing for people to remember is that collaboration is a two-way street. And that means referring back and forth. It means communicating back and forth. And it means both parties having the interests of the patient at the center of their practice.
Yeah. It makes a world of a difference if you can get your ego to the side, hey?
Yeah.
Right? And then just focus on patients. Which
Absolutely.
I think that's why we get into nursing and or dealing with patients in the community, is because we're centered, focused on them. Mm-hmm. I would think, right? If you've chosen to integrate foot care nurses into your practice, what would lead you to that decision?
Well, as you get busier and get busier and get busier, and you're looking at people and saying, okay, this person really needs more than I'm able to give right now. Mm-hmm. How do I find a way to do that? And so by bringing a foot care nurse in, again, I can focus on the most complex of cases, mm-hmm. and she can take care of the rest. And we share people depending on their needs, and we communicate depending on their needs. Right.
Depending on, whether they're within their scope too, right? And then mm-hmm. you're right there to be able to watch and see if there's a wound. We get so many ingrowns, and it's so great to have the chiropodist close by that we can get them in right away mm-hmm. to help with infection and pain. Pain control is huge. And then do you think your practice will change once a foot care nurse becomes part of it? I know you're on that route, but they haven't started yet. But do you think, what do you think will change? I think things will just be more expedited. There won't be.
Not only will they be more expedited, there are patients that the outing, the relationship is the biggest part of coming into the office.
Right.
And with greater pressure, with more patients in, I don't have as much time as I used to spend with them. Mm-hmm. And so that can be reintroduced, I think, and that will make their experience more pleasant.
More pleasant. And then it'll just be better patient flow, clearer mm-hmm. escalations, fewer complications, hopefully.
And I won't be talking to myself as much.
Right. You'd have someone to be able to
exactly
to hang out and be a buddy with.
And commiserate with.
And then it would just protect patients all around, right? This model would, this collaboration, I think, would be just amazing. And it could just be that center of that focused patient care that you originally would want.
Exactly.
Right?
A lot of people don't realize that when the Regulated Health Professions Act was created, it was done specifically to allow overlap between professions and choice by the public as to who provides their care.
Right.
And that overlap and that choice allows for, I think, better care for the patients in the long run.
For sure. What expectations do you have of foot care nurses? Well, I guess you don't work with any foot care nurses right now, right? Is there any expectations that you would have bringing them into your clinic?
Well, I
on what
think
they would be able to do or provide?
There are some foot care nurses that are out in the community that I connect with, and
Yeah.
my expectation is that they would communicate if there's concern, if they run into something that's beyond their scope.
Right.
In addition to that, some of them are working for community organizations and doing wound care. And what I'd like to see more of is greater education on the wound care side, whether they take the SHARP or the Wound Care Champions program with Wounds Canada, so that patients are getting what they're supposed to, because I see an awful lot of people, again, falling between the cracks.
Right.
They've had a total contact cast, the wound is closed, and they're discharged, period. So they didn't move to a boot. They didn't get into proper footwear and orthotics. They're going to break down again and go back through the system again.
Right.
And it's not good for the patient.
No. And then I guess for the expectations for foot care nurses too, like they would, having proper documentation and professionalism, working within like a team.
I think it's going to be an eye opener for some. And I think that's a really, really good thing.
Yeah. Are you going to take heat? You
So,
think?
Me or them?
Yeah, you. Like just from like other colleagues or whatever?
Oh, who cares?
Yeah. I don't know, some people. What makes a referral from a foot care nurse strong and easy to act on if you get one in? Like, is there any specific?
If I get one in, they know it's something that they feel needs to be looked after, and they can't. So the patient's already been seen. They need to be taken care of. And that's been a really important part of the relationship with the nurses that I deal with.
Right.
Where I run into a problem and I've had to raise concerns is somebody who's got cellulitis, is infected, and the nurse says, "Oh, you can wait until you see him next week," instead of picking up the phone and calling.
That's a huge difference between what can happen from that day and
Absolutely.
for a week.
Absolutely. So education is important.
Right. And then is there something that makes it easier for you? So let's say I'm a foot care nurse in the community and I live around you and you're one of my referrals. Is there a specific way that you want referrals to come in that's easier for you to read? Like, do you just have point form? Do you have something faxed? Do people just call you, the nurses? Is there a specific?
Just call.
Just call and say, hey, you need to see this person.
Yeah.
Okay. If the foot care nurse wants to be a strong, respected part of the multidisciplinary team, what would they be focusing on?
Professionalism. So that means communication is key. Documentation is key. All of the things that make people feel that the patient has been taken care of.
Right. Because it's not really like strong teams aren't built on like territory, right? Like it's.
The patient is our territory.
Yeah.
And the care we share.
Yeah, absolutely. I agree. Thank you for coming out.
Thanks for having me. Glad to be here.